empathy is like the main tool that healthcare professionals use. It's like the center of the interaction, right? But that same bridge of empathy that's between you and the patient is the way that you can experience their trauma. And when we don't have a way to cope with it or something to do with that experience, then we are really at risk for secondary traumatic stress.
Hey, healthcare providers, you're listening to the Burnout to Lit Up podcast. Hosted by myself, Erica, and my husband, Michael. We're an OT-PT team that understands the healthcare industry's got some serious issues.
Inspired by our own experience with burnout, we've made it our mission and passion to help you navigate your career in healthcare by cultivating wellness, growing both personally and professionally, and advocating for a better workplace.
Whether you are a clinician or manager, new grad or seasoned vet, join us each week as we share interviews, research, stories, and strategies that will give you the tools to go from burnt out to your most lit up self.
Let's dive in.
Hey, welcome to the Burnout to Lit Up podcast.
What's up, guys?
So Mike and I have been listening to a book on Audible by Joe Dispenza called, I think it's called Being Supernatural or Becoming Supernatural. It's
called Becoming Supernatural. Joe Dispenza.
Yeah, so we've been listening to it in the car every day. It's a long book to get through, but like, whoa.
A little trippy. And honestly, in a way, hard to believe for me.
So this is my second time reading or listening to, I should say, a Joe Dispenza book. And the first one I listened to was The Habit of Breaking Yourself. And that book changed, like, I love the other book, what's it called? Oh my God, by Jen Sincero on You're a Badass. That book was like, I would say my first personal development book, but then later on when I listened to Joe Dispenza's book, The Habit of Breaking Yourself, that like took it, I was ready for that because I read You're a Badass. Like you have to like...
That first book though wasn't about meditation though, was it?
It was about manifestation.
Oh, so...
so it kind of like laid the groundwork. It's a great book. I always recommend You Are a Badass. But that laid the groundwork. And then I also read You Are a Badass with Money. That was a great one too. But Joe Dispenza's work, man, like I have to pause if we're like, we listen to it when we're driving. So I'll pause and I'll just like have to process that sentence.
It's actually kind of hard listening to books because I never did that really before.
I never did that before either.
And it's like, if you miss something in a book, you can just like read back through it. But if you're driving, you're listening, it's kind of hard. You'd have to like actually press the rewind, like, back 30 seconds. I
mean, how many times do I rewind? Like a lot.
But I mean, even then, it's like, we talked about. Well, anyway, long story short, this book is it's about meditation and about changing
rewiring your brain and your body so that you can become a better version of yourself. And the science, like in the quantum physics that he goes into, like the things that he's going into, I don't even know where to start.
No, I mean, a lot of it's really, really neat and like makes sense to me as like a person who like understands like biology pretty good, at least
I understand biology pretty good.
At least I think I do. But like, it makes sense that like if you're, he goes into a lot of like how your thoughts are going to influence your biochemistry and make you more predisposed to thinking a certain way. If you're anxious all the time and you think about being anxious, you're going to make yourself be anxious without being anxious. You know what I mean?
He talks about the conscious and the subconscious. He talks about matter and energy and...
yeah, all the deep stuff.
And a lot of like physics. He talks about energy centers. We're not done with the book yet. I think we have 3 or 4 more hours of listening. But it's like...
Some of it's a little out there though, like...
But I'm so
he tells
open
stories
to it.
about like
I'm so ready for that.
Yeah, about like meditation and like super deep meditations where he's had like visions and stuff and like weird,
the visions. Yeah, that was
weird things that are trippy. Like,
but I'm so like open to that like side of exploring myself and the possibilities in the realm. He talks about the known and the unknown. like, and I'm talking about this because I highly recommend you guys listening to it or reading it. We can link it, you know, like let's link it.
Yeah, sure. If nothing else, it helps me really relax, especially at night, because we're meditating now before we go to sleep, and it's like it helps me go to sleep.
So I'll fall asleep at the end of my meditation. I used to meditate in the mornings. Many of you guys that have been following me for a while have, you know, known that I've talked about meditating in the mornings, but I felt a lot of pressure to like get it done like 10 minutes, and I couldn't really go as deep as I would like to. So now we're meditating at night, and my meditation is really opening, and you know, it's not always perfect. You know, like last night I couldn't even like get into it, and I was just like tired and restless. But like when we're committed to it,
if you're too tired, it doesn't work out. Like last night. Was it last night? I was like, can't do it. Too tired.
But the thing is, now that you and I are doing this together, like we're not talking, we're not listening to anything. We're just like meditating together. This is so like new for me, and sometimes new things can be scary and they feel uncomfortable and unknown, and it's hard to like make a commitment to it. But if you make a commitment to like spending that quiet time with yourself and whatever you want to call it, like prayer, meditation, reflection, journaling, because I still journal in the mornings. I find that this morning/night routines, they help you to reconnect with your soul and your gut, and you get to like have that special time to yourself.
It's me time.
Me time, bitch.
Need that me time.
Gatorade me, bitch.
Yeah.
Breaking Bad, right?
Yes.
Yeah. So, okay. It's.
I wish I had time to rewatch that series. Or you know what? There are some series that I wish I could erase my own memory and rewatch again. Breaking Bad is one of those series.
Breaking Bad you got me on that.
Just a special treat for your brain if you've never seen it.
I haven't watched the series. We haven't watched the series in a long time because
just Game of Thrones, really. That's the only one. Which is
coming out soon.
So actually a new trailer came out, and your mom was the first one to send me a trailer for it.
My mom ruined Jon Snow's, like, I'm not going to say it.
No, it's been plenty of time. Everyone should know.
But my mom ruined that for me. Like,
everyone should know.
So anyway, let's pull a Gabby Bernstein card.
All right.
You want to pull one? I feel like you should.
Okay. You want to read it? I read the last one.
Okay. The more energy and intention I bring to my faith, the more fearless and free I am.
Nice.
I actually pulled this card this morning.
Speaking of energy, we were just talking about that book. That book talks a lot about centering your like attention and your intention and your energy and stuff. Just kind of a neat way to think about things.
Yeah, like I spend a lot of my time like bringing myself back to the self-awareness of being intentional, focusing my energy on things that are going to raise my vibrations as opposed to lowering them. I mean, I do, again, and it's also like no one's perfect, so when I get mad or when I react to something that I'm not really like, I didn't really like how I reacted to it, I'm practicing more self-compassion now, and I'm just more aware. And I don't know, would you say that I'm like responding to things in a better way, like kind of more calmly? And
yeah, I think so. Great example when we got our car broken into.
Yeah.
Window smashed and everything, and it was like Erica's laptop was stolen, and it's like we could have both freaked out and been really affected by it. But honestly, I think we both took it really well. We just figured out the problem. We got it fixed.
I had a moment, I had a moment of shock. Like, what the fuck?
It could have been way worse, right? So it's like, yeah.
Yeah, like, I think that was a test. Like, the universe tests you.
Now you have a way better laptop.
Now I have a way better laptop. That laptop needed to go, so it was, like, perfect. Like,
some fucking dumb criminal is out there with a laptop that
a ratchet ass keyboard
that the I and the U keys don't work.
Several keys.
The webcam is only infrared.
Yeah.
The screen has like cracks in it, and there's like a billion assorted files and articles that aren't organized.
That was the universe helping me to cleanse. I needed to cleanse that laptop, but like it didn't work properly. So like,
and
they actually did me a favor.
Yeah, they got a $12 keyboard from Target too, like USB keyboard.
Yeah, now like
jerks.
Yeah, just working on showing up as a person I want to be. I want to be more in control of myself and my emotions, and being more self-compassionate with myself. And so yeah, like I like this card a lot because the more fearless and free I bring. Okay, let me start again. The more energy and intention I bring to my faith, the more fearless and free I am. Like, I think that's such a powerful phrase, fearless. I like analyzing these cards because, like, when I do this in the morning and I go through these cards, I kind of go through them briefly and then I journal. But like talking about this, I hope like when we do this card pool for you guys, it's something that maybe you needed to hear, or something for you to reflect upon.
Yeah.
So cool.
Yeah, we gotta talk about the guest because we are already getting up there in the time.
Well, Lisa. Okay, so Lisa is our guest today.
Lisa, and what's her last
Lisa
name?
LaBrie. She's a nurse. She's an educator, author, and speaker. She focuses on helping healthcare professionals learn to care for themselves. So, obviously we're all about that, in order to find joy and meaning in their lives. She began her career in nursing in 2004, and starting as a new grad in pediatric oncology and bone marrow transplant unit. Later on in 2009, she moved to adult oncology and bone marrow transplant. And in 2001, so I'm like kind of jumping around here, she helped build a new allogeneic, is that how you say it? Okay, bone marrow transplant program, including designing an education program for the nursing staff. So she's had a lot of experience. And then from there, she worked as the inpatient nursing educator. In 2014, she struggled to find balance and happiness with work and life. She was regularly experiencing exhaustion and she was unsatisfied at work. She wavered between numbness and feeling overwhelmed by emotions. During that time, she changed her role at work several times, trying to find the solution. Eventually, she went back to school for a master's in teaching and planned to leave the nursing profession. So in 2017, when she graduated, she took a leave of absence and went to Europe. So she talks about that. Yeah. Super, super cool. So since that time, Lisa realized that she was experiencing serious burnout and compassion fatigue. So I've been there. I know all too well, exactly what Lisa was going through. So she spent a great deal of time working with a therapist, reconnecting with herself and her relationships, and realizing that so many others are struggling with the same issues in nursing. True that. She now writes and speaks about self-care for healthcare professionals, and she can be found at selfcaretravels.com.
Sweet.
She's not the first one that I've heard recently, like just within like the people I'm talking to, that has taken like leave of absence and like gone to Europe or Antarctica or South America. It's like, should we take a leave of absence? And just like,
our life is a leave of absence, to be honest.
It actually is. That's so true.
Like, travel therapy, it's like just allows us to do a lot of cool things. So
yeah.
But I mean, talking about like compassion fatigue, it's like, I mean, that's real, especially if you're in healthcare. It's like, all you're doing all day long is hearing about people's problems, and people are like super low energy typically, and like you just absorb that. You absorb too much of that. It's like you just need to get away.
Yeah, actually, really quick, I was reading a study today on nurses that they looked at 2 interventions, increasing empathy and then self-compassion, and they found that increasing empathy in nurses actually had increasing empathy in nurses had an adverse effect, because they had almost like too much empathy, and the nurses in this study
I can burn you out too. I mean,
well they carried it with them, and they became more emotionally exhausted. So that didn't help them to recover like more empathy, because I feel like in healthcare we're already pretty empathetic. With burnout, you do have that depersonalization, you have that cynicism. But in this study, they found that instead, self-compassion was a way more effective intervention, because nurses were able to exercise that ability to be kind to themselves, and it helped them to replenish more properly. So just like a fun fact, because I just read studies all day in the library, so like they're just always floating in my mind. I'm a big loser.
Erica hangs out in libraries. LOL.
I wear the same sweater.
Libraries are actually awesome.
Yeah, I love libraries. I love like taking breaks, walking through the aisles, and like looking at all the random books. Like I love it so much. Okay.
I feel like, and I don't think this is a bad thing, I feel like sometimes in my practice I have to step away from, not from caring, but like from I don't know. I feel like if I always like care 100%, I'm screwing myself for like people who come after, like, you know what I mean? Like for my next patients, it's like I need to like dial back the caring a little bit, like so that I can just get through my day. Because if I beat myself up about every patient who doesn't get better or is, you know, still in pain after a couple of sessions, it's like, you know what I'm like trying to say?
Yeah.
Like, it's not that I don't care.
I know exactly what you mean, because when I was, you know, first starting out too, I cared so much, and like hurt me when I couldn't like deliver, because you can't fix like you do your best and you help people get better, and you can control like your, you know, what you do with them. But yeah, it's like that price, like it's setting that emotional boundary, which is healthy because you do care, and you provide your listening, your therapeutic sense of self and all that, but at the same time you're able to like draw that line, you know, and you're there for them. But when it's time to see your next patient or it's time to go home, you know how to like put that away, which is really hard. And Lisa talks about that. We get into that. So I'm really excited for you guys to listen to this one. It's a great interview. I love talking to Lisa, and we have a little favor to ask of you.
What is that favor, Erica? What is it?
Yes, my dear husband.
My loving wife.
If you guys can leave a review, rate us preferably 5 stars, and share this podcast with your friends. Like, you know,
that's really
sharing is caring.
No, I don't. I mean, that's the main thing, really.
Yeah, as long as share it, and
if you guys like the show, you think other people might, pass it along. You
know, like post us on your DMs, tag us.
Post us on your DMs.
Oops.
What does that mean?
Post us on your stories. Sorry. Post us on your stories. Slide into my DMs. And see you guys later. Talk to you guys later.
All right. Goodbye.
Bye.
Yeah, so my story, it's a long one. So I'll start with talking about myself as a nurse. I became a nurse in 2004 when I graduated like my associate degree program, and I started immediately working in pediatric oncology and bone marrow transplant. And I've spent most of my career in just oncology and bone marrow transplant. Working in peds for about 5 years, and then I switched to adult oncology and bone marrow transplant in 2009. In 2011, I was asked to help design and support a new transplant program in Southern California for allogeneic transplant, which, if people aren't familiar with, it means donor that's not the patient. So there's autologous, where people donate to themselves, and allogeneic, where they have a separate donor. And because they were starting a new transplant program, they asked me to do the education, because no one who I was working with actually had any experience with allo transplant. So I designed the staff education and became the staff educator, where I worked for several years. But during that time, in nursing school, they really don't teach you like what you're supposed to do with all the stress or the feelings that we experience caring for really sick patients. There's a lot of focus on how the patient experiences it, but not, okay, what do you do with it?
Right.
So, just kind of the same thing that a lot of people talk about when they talk about burnout. I started experiencing, like, sometimes I would feel like really disconnected from my work, or sometimes I felt over emotional and like overwhelmed with feeling and kind of like, what do I do with all these feelings? Where do I put them? So because of that, I started feeling like, well, maybe I need to change where I work. And so I changed actually position like a bunch of times in like 3 years. I went to an outpatient area and was like a supervisor in the clinic. I went back to the bedside and just worked as like float pool nurse. But all of those places, I still felt like I was really struggling with dealing with all the things that I had experienced as a nurse. So then I sort of thought, well, I'm going to leave nursing completely. And I went back to school and got a master's in teaching and was like, I'm just going to, leave this hospital setting. And then when I graduated, I took a leave of absence for 2 months and I went to Europe. And then I just did nothing. I took like a German class. I like ate a lot of food. I went to museums. And then when I came back, I really felt like, okay, there's like something I really need to do here. I really need to get like more in touch with myself and like who I am and all of these feelings that I have and like how am I going to go forward from here? So I got myself a therapist and I started really working on what is burnout. It was something I kind of was interested in all along because as an educator, I started looking at the staff going, I think they feel like I do, but nobody's saying it. And then when I would start the conversation in a class, like people would start crying out of nowhere. And I was like, oh my God, we're all feeling something here. Mm-hmm. So now I teach at a nursing school and I teach a writing class, a research writing class for nursing students that I really enjoy. But on the side, I just really decided this is something that needs to be addressed. And I write some articles, I do speaking engagements, and I'm just really trying to build a focus on taking care of ourselves and getting back to like this thing that no one taught us in nursing school on how to like find meaning and joy in our work while incorporating all the feelings and experiences that we have taking care of patients.
Yeah, wow, I love that. I love that you're transitioning to this platform in this place where you're filling in this gap that I have identified as well. And this is like a side note. I don't know if you're aware of this, but in California, when I was looking at the state of California Board of Nursing and other boards in terms of like providing a continuing education course around burnout, California Board of Nursing specifically does not allow any continuing ed around burnout, meditation, yoga, etc. So I think it's like because they're explicit about not allowing those continuing educations, at least in this state, and at least for just like that board, it leads me to think that it's still like not a priority and it's not seen as important. It's not viewed as important.
Yeah, I think like I've looked at the same CEU requirement for the course provider because I used to provide courses at the hospital, and there's kind of an umbrella you could put it under when you're saying you want to educate people on burnout, compassion fatigue, and secondary traumatic stress. But they want you to sort of educate like on an institutional level more. Like you can talk about the data, you can talk about how it affects staff retention and turnover. I feel like they are okay with you coming at that angle, but just like you said, there's that section that's like, it can't be a self-help class, but we need to help ourselves. That's the whole point. We need to help ourselves.
Yeah, we need to. And I think that for, like you said, at the institutional level, it does relate to turnover and tenure. But when you go down to the person level, it's it's burnout and stress, and organizations, like if they viewed it as actually there was a study on like there's so many studies on nursing and burnout, and there was one study about how nurses that were burned out, patients perceived these nurses to be providing a lower level of care, and there's also a higher risk for mortality. So although organizations may not think of burnout as their problem, it actually is.
Yeah, and it's not just, I feel like on the institutional level, there's always a framework that's looking at it from, this financial perspective in terms of, high turnover means that you have to pay for training of the next nurse, and this like, oh, how can we reduce turnover? And that's totally tied to their desire to apply for magnet status, which I'm sure if you know, being at these different hospitals, you might hear people want to aspire to magnet status, because part of it is they have to have, you know, their nurse satisfaction survey results. So they need to have a good nursing satisfaction result as part of their magnet application. So they're tying it towards these like institutional aspirations and financial goals. But just like you said, right down to the individual level, there was one study that I read recently that said 50% of millennial nurses are already planning to leave the bedside.
Wow.
Half of them.
I believe it. And reading studies like that, and the one I read, and there's so many, like, keeping up to date with that, it's, you know, it doesn't surprise me, because I see other industries, they're light years ahead in terms of employee well-being and making sure employees are happy. And like, for example, I'm in Silicon Valley, so I hear about like the craziest things that in healthcare we're just not even there yet. And you know, there's so many like different ways we can go with that, but like, what do you think like could be something that organizations can do, something like you're trying to bring to the conversation, that organizations can do to start like taking their employee health and well-being more seriously?
Well, I think that lately what I've been considering more and more about this is that it needs to be like a game changer. It needs to be revolutionary, because I think that a lot of institutions are implementing maybe small tweaks, but they're not correcting the overall problem that begins to snowball and compound itself. You know, because when you have that dissatisfaction, high turnover, you know, then you have this huge nursing shortage problem that we face in the world, and people leaving the profession, which means more nursing shortages, which means staffing is really tight. And I know from the administrative level, like that's one of their big focuses is staffing. But it's almost like they're chasing it instead of coming at it head on. You know what I mean? Like it's a reactionary instead of proactive, where you really have to change a lot of things that are happening in the hospital and the way that we function and the way that we see nursing, so that people want to keep showing up and not leave. And it's I think a really huge project and something that will probably take time to do. But you know, those industries that you're mentioning, they're sort of in some ways like, you know, big game changers in their area, you know, like the Google, the Facebook, the whatever, like they were big game changers anyways, right? At delivering whatever they deliver completely differently to the public. And I just wonder if we have to look at healthcare, and I don't mean commodification and like as a business, but look at it differently. I mean, get back to the human level. I think that we're missing getting down to the human interaction and approaching it differently, because you know, at the bedside, nurses are getting more and more complex. They have more and more machinery to manage, more and more tasks to do that take them away from like being with their patient and interacting with their patient, which can leave them feeling disconnected to their work in some ways. I don't know. I think we could go on and on. It's like super complex, but so interesting to me. Like I get really excited and into talking about it.
Yeah. You went through it. Like you went through these signs of burnout, and so did I. And I just, like when you said bring the human back into it, the humanity back into it. Like I just remember so many meetings, just throughout like the places where I've worked, and it's the way that we even communicate as a team. It's it's the way that we and I
support each other.
Yeah, or lack of support, you know. And it's the way that like it's the way, like, for example, we put our patients first and we care about the quality of care. And of course, all that, you know, is super important. And a priority for us. But in a lot of meetings and a lot of just like transactions where I've worked, there was like this neglect of the person as a therapist. Like you're just a person, like a warm body to do therapy, and that's it, you know?
Just a staff member, just a person there to get the adequate numbers for staffing. Because, you know, in California, we have nursing ratios. And so, you know, there's a lot of work to make sure you're in ratio, you have the right number of nurses for patients, the right number of people, like you said, bodies in the building. But what's happening to them?
Yeah, like what's happening to us as people. And that's what I think about. I don't know if you can relate to this, but this analogy I came up with to relate to my own experience, where burnout for me is kind of like when you go to the beach and you go in the water and you leave your towel and your chair, you know, on the shore, but then like you're in the water and then an hour passes by, and when you look to the shore, you've completely drifted, and that's when you realize, oh shit, you know, like I've drifted little by little over an hour, but I didn't realize it, and then when you look back, it's like too late. Can you relate to that? Or like how, because you were in different settings when you were going through your burnout and you tried different settings, so how was that experience like for you?
So and this is kind of like, you know, more about my personal experience with burnout and compassion fatigue, but my therapist made me read this book, Codependency No More. It's kind of a classic book about codependency with, you know, somebody who uses drugs. And I was like, I don't have somebody who uses drugs in my life. Like, why do I have to read this? And she was like, I really want you to read it and pay attention to it. And it really highlighted some really key things for me in nursing. You know, our whole identity as healthcare providers is that we are helpers. It's a giving profession. We help other people. And, you know, just like you said, we put that above everything else. It's like innately tied to who we are and how we see ourselves in the world. And we can have a like kind of a dysfunctional codependent relationship with that, where we only see our value through that lens and not ourselves individually. So reading that book, at first I was like, whatever, I don't want to read this. And then I started reading it and like noticing some key things that I could really relate to, because I really did see my value in my ability to help other people, and I demanded perfection. And we are like nurses and healthcare professionals are like really hard judges of ourselves. We are really critical about every little place where we're not helping enough or we're not meeting the patient's needs. We can be much harder on ourselves than anyone else. For me, that was really key in how I saw my own burnout experience, because I expected perfection for myself at every aspect of my job, and I didn't. And there was very little space to make a mistake, because you're thinking, if I make a mistake, somebody could die. And where in life is there really perfection that exists? Nowhere. But that's what we expect of ourselves.
Yeah. And I remember talking to one of my classmates when I was still in grad school, and he was talking about why he chose OT. It's funny that you said, because if you make a mistake, a patient can die. And when he was talking to me, I remember this. He said, I chose OT because it's medium risk, medium reward. Like, we're not going to kill someone, but it's still like, I don't know, the way he put it to me, like, yeah, I see what you're saying. It's, I guess, you know, every profession has their own set of challenges, pros and cons. I never saw it that way until he brought it up. But even, you know, I have lost plenty of sleep because I've made mistakes with patients. Again, not life-threatening mistakes, but I've made mistakes where I've lost sleep. Where I can't, like, I wake up thinking about that mistake, and whether it, you know, a mistake is a mistake. And to us in healthcare, if we're ruminating and perseverating and we can't let go and we can't move forward, it's, for me during that time, it was a huge block in my life.
Yeah.
Yeah. It's,
I love that you said ruminating, because that was like a word that I really attached to in the last few years, when I because, you know, I didn't really learn to reflect on my own thought process but that's exactly what will do when we'll get stuck in this thinking about a patient situation or interactions and repeat it. What could I have done differently?
Yeah.
How could I have been better?
Yeah. It's, it's one thing to like, you're constantly learning in healthcare. So it's one thing to, make a mistake, have a healthy dialogue about it, and then move on and then and learn from that. But it's another thing where you're beating yourself up and you can't move past it.
Yeah, exactly.
So I know you talk about secondary traumatic stress, also known as vicarious trauma, correct?
Mm-hmm. Yeah.
So, yes. Can you talk about that a little bit?
So a lot of research started in this area looking at actually psychologists and social workers have a bunch more research literature on it and writing on it, I find, and some of the really strong work that we can directly apply to other professions. But this vicarious trauma is the exposure to traumatic experience of patients and then vicariously taking them in and feeling the emotional pain of the people you care for. So you can imagine definitely this affecting disaster workers or first responders, right, who show up and take care of the immediate aftermath of a trauma. And then it manifests similar to PTSD. So you incorporate the patient's trauma and experience the emotional pain of it such that you also begin to have symptoms that are very similar to PTSD in yourself. And this is because empathy is like the main tool that healthcare professionals use. It's like the center of the interaction, right? Like your work as an occupational therapist is grounded in empathy. Your assessment of their needs and making a plan for them is grounded in that tool of empathy, right? Mm-hmm. But that same bridge of empathy that's between you and the patient is the way that you can experience their trauma. And when we don't have something a way to cope with it or something to do with that experience and to process it, then we are really at risk for secondary traumatic stress. So there's specific risk factors, like if you're in a really high stress environment, the higher the stress, like the ER, the ICU, certain places have a higher stress that people experience. And it's the amount of hours. Some of the research shows it's the amount of hours that you're at work. So the amount of days and the length of your shift increases your risk. Also, if you have a personal history of trauma, which this is actually something that I feel like in a few places, it's one line in the article or one line in the book. But I think this is super important because I tell my students about this all the time. You will think of any personal traumatic experience that happened in your life. You definitely encounter it again in healthcare. It comes back at you and you have to revisit it. I don't know if that's ever something you've experienced, but a lot of my students report that they went into healthcare because they had a family member who died from some particular illness, or their family member experienced a healthcare scare or experience that was a huge jarring moment in their life, and so they say, I'm going to go into healthcare and make a difference. And in that going into healthcare, they definitely have to revisit that experience. Obviously, the greater the amount of trauma that your personal history includes, childhood abuse, sexual assault, some kind of violent trauma, or even some traumatic experience like car accidents, you can definitely have that in your history and then re-experience an event that triggers that memory of that trauma.
Yeah. Okay. Yeah. So is this secondary traumatic stress, is this similar to compassion fatigue?
This is if you looked at a burnout sort of spectrum, this would be further down the spectrum where you have not addressed the multiple experiences you're having and feelings you're having and the struggles, and it's compounding, and it can lead to sort of this further and where it's secondary traumatic stress. Or it could be just triggered from a very traumatic event.
Oh, I see. Okay, so you talk about a spectrum. So I'm visualizing, because I think that it definitely can be along the lines of a spectrum, with different points, at different stages. So what would be like on one end of the spectrum and then moving towards the other end, in terms of secondary traumatic stress and burnout? Like, what is something that either you've experienced or you typically see on that spectrum?
Well, I think that, we all go into this for the idea of compassion satisfaction, which is the term of where you're getting a lot of meaning out of your work. You feel really connected and purposeful. So compassion satisfaction is kind of the place that, we all start out in when we're really excited and we're like, yeah, I'm making a difference. I'm really helping someone. And it's the place we want to stay, where we have that professional role satisfaction. At any point, though, without the support, the coping skills, and the balance between our work and life, we can get out of role satisfaction and into various aspects of burnout, which are related to different things. So there's, burnout that's related to the workplace in terms of not enough staffing, not enough supplies, not enough resources, interpersonal problems. But there's also other things like moral distress, when you feel like there's serious moral struggles happening at work, where they have ethical issues, or you question the decision making, and you struggle with going home and living with the decision making that happens for patients. There's grief, compassion fatigue, and secondary traumatic stress.
Yeah, you touched upon moral distress and all the different types, different types of encounters that we can experience. What are some of the consequences of being exposed to secondary traumatic stress? Because I know that could be different for people, and it can manifest in different ways. So I guess, what are some of the most common consequences?
Yeah, so it does manifest differently. There's these psychologists who identified different reactions in therapists to trauma work, but I think they can apply to nursing. And one is intrusive preoccupation of the nature of trauma work experiences. And that's that hyper-vigilance. And I can definitely say I know nurses like this, that hyper-vigilance. They call at 3 a.m. to check on a situation. They are staying late, constantly going over everything, checking their charting one more time. It's, sort of this preoccupation and focus on what's going on? Did I check it? Did I do it right? They don't sleep well. They can have nightmares. They might have exaggerated startle response. So these can also affect their self-identity and their worldview. Because, like I said, we really identify ourselves with our work. And so if you are struggling with these traumatic events, you also start to struggle with your identity, because it's so tied to your work.
Yeah, I talk about that all the time. Just how we work a lot, and in the States we work on average 7 hours more than those in Europe. And from some of the latest studies, I read that Americans work on average 47 to 50 hours, and then those that work over 50 hours in general, if you work over 50 hours, you're exposed to greater risk of cardiovascular disease. So I know we work more in the modern world. We work more, and we're so connected to our work, and we do enter healthcare because we have this compassion satisfaction, like you said. And what's interesting to me is when people, I've read where people that are over-engaged, you look at engagement as a really positive thing because it has positive qualities like absorption in one's work. You have energy, there's vigor, and then you look at burnout on the other end that has negative qualities. But do you find in your experience that someone that is over-engaged can also exhibit signs of burnout?
Yeah, that's actually one of the factors, and this might be a little different than the engagement you mean, but one of the factors that the psychologist identified is over-involvement and identification. And I've seen all of these in oncology in different ways, but this is the opposite of avoidance and detachment. So that's another factor, is people who, avoid and detach and become numb. This is that person that everyone thinks they work with who just doesn't care anymore. But it's this real withdrawal and numbness to the avoiding talking about personal issues, avoiding talking about feelings, avoiding intimate conversations. But the over-involvement is the opposite of that. They become over-involved with the patient. They over-identify with the patient's situation, and they become personally involved. And this is something I actually talk a lot about to new grads. In the era of new media, of social media, I tell them, like, don't be your patient's friend on Facebook. But this happens a lot in oncology. We see them for like 2 years getting cancer treatment, especially like kids with leukemia, right? And bone marrow transplant, they're in the hospital for like 30 days or something. You really get to know them. And there's this tendency for nurses to become their friends, like on social media. But then they become sort of over-involved in their lives. And we have to have some clear boundaries to protect ourselves, because the outcomes we can't control. Like, not every patient lives. And when you're friends with someone on Facebook, and the event that happened when they passed, it could have been a traumatic code or something like that. And when you're friends with them on Facebook and you see like the posts from all the family members talking about them, it can bring you right back into that moment, where in your personal space on Facebook, you're not getting a break from your professional space.
Yeah, I've had that. I definitely can admit that I'm guilty to befriending. Well, when I would leave a clinic, parents would send me, because I worked in pediatrics, so parents would send me friend requests. And I am still friends with many previous patients, but I did have a huge Facebook detox for several months, and I'm kind of like slowly getting back on. But it is true, because when you are not able to psychologically detach from your work, and that's even further hindered by logging onto Facebook and then seeing your patient's family updates and etc., then that can hinder your detachment, and then you're not mentally able to recover. That's one of the biggest things that some of the research I've been looking at talks about, is that psychological detachment from the work, from your work. And that means totally mentally, not just physically leaving work, but mentally detaching from work.
Yeah. I know that when I used to leave the hospital, I started like consciously on my way home making strategies to leave work, like choosing certain music, just like you do maybe on the way to work, to get ready for the work. But I started at one point being like, you know what, I need a way to turn this off. And so I would like purposely choose something specific to listen to. I might do I sometimes did a like check in with myself. How am I feeling about the day? What emotions do I have? Maybe I need to make a little space for them on this drive home so that I can let them out or think about them and process them before I get home. Because I started finding myself like really wanting to be more present at home and not carrying all of that with me everywhere at home. I don't know if you do that kind of like some kind of way to decompress on the way home.
Yeah, I talk about that. I'm actually, one of my upcoming posts on Instagram, because I plan them out in advance, talks about creating a routine about decompressing on your way home from work, because I found that personally, like I ruminated in the past. I constantly ruminated. I would listen to music on the way home, but I still like I would turn off mentally and just like not even listen to the music, but still ruminate. And then like I would go home and then watch TV, maybe work out. Like this was during one of the harshest and most critical points of when I was burned out. Although, for example, I'm into physical fitness and that's one of my favorite occupations and leisure activities, but it's like I cannot mentally detached, and everything in my routine was based around like a fear that I wasn't prepared enough for the next work day. Mm-hmm. You know what I mean? So it was just I was very stressed even at home, and it was like going on in the background. It was like my constant background music was anticipating work stressors.
That really reminds me of my husband. So my husband is also a nurse, mm-hmm. but he works in the cath lab, in EP and electrophysiology and cardiac cath lab. And so because he has call time, I really see that like call time really affects him. And I didn't really think about it until these past couple of years, is that when he's on call, I mean, he's like has to be mentally on to be at the hospital in 30 minutes for an MI. And they have, 90 minutes from door to balloon to get the procedure done to save the most heart muscle. And so when he's on call, I used to kind of be like, oh man, he's on call, we can't go anywhere too far away, it's kind of a hassle. But more recently I started observing that like he has to be mentally on and be ready, like you're saying. It's like 24 hours, it's all weekend long, 24/7, be ready to do the best at work, to not make a mistake, to be adequately prepared. And if they go in and have a really bad case, he's become more aware of how it's like impacting him. Like he doesn't sleep. He started having, kind of some of those hyper-vigilance, like, I want to go back. I can't wait to get back to work to check on what happened. What was the outcome? How are they now? And so we both were like, oh, this is kind of what we're talking about. Like, if you have a really traumatic case where somebody comes in and the procedure doesn't go smoothly because they're quite sick, it can really leave you with these symptoms of like wanting to go check and to be preoccupied and ruminate and think about it. What did I do? Could I do anything different? And not sleep.
Mm-hmm. Yeah, sleep is one of the biggest ways that we can replenish ourselves. And I recently interviewed someone, and depending on like how I release these interviews, because I haven't organized that yet, I don't want to give it away, but I interviewed a sleep expert, and we were talking about quality of sleep versus quantity of sleep, because when I was stressed out, and not even stressed out, but like when I was dealing with burnout and high levels of stress, I would wake up, I would sleep 8 hours, probably more than I am now actually, but my quality of sleep was so poor. I would wake up with intense neck pain, and I had my hands clenched in my sleep, and I think the trauma, I carried it in my body and my brain, and it was, again, like, it was always on.
Yeah, 100%. Like, somatization of what we're experiencing emotionally is like a real thing. I think a lot of people have talked about this, the extreme stress that we feel and our emotional state is manifested in us physically, and we do get physical symptoms like headaches, fatigues, and even my dentist said there's like an increase in like teeth grinding, in our society, which I'm totally one of those people who grind their teeth.
Me too.
Like as I've been working in nursing, I was like, oh, I need a bite guard at night because my jaw is clenched. And she was always like trying to massage my jaw and say, wow, this is really tight, Lisa.
Yeah, one study I was reading said that, and those that were in the people in the study that were experiencing burnout, they all had at least one other physical or mental condition, whether it was depression, that was the highest mental comorbidity, or musculoskeletal pain. So we do, when we are dealing with and undergoing burnout, we carry these symptoms with us, so it impacts us physically and mentally.
Yeah. And just like you're saying, sleep, I love sleep. That's one of the biggest things that I've learned about myself is adequate rest, because I started out actually in my nursing career working the night shift, and I also had small children, and I wanted to be, and goes back to this idea that my therapist made me read, that codependency book, but I wanted to be everything to everyone. Like, I wanted to be an amazing mother, I wanted to be a great wife, and I wanted to be a perfect nurse, and I didn't sleep enough. Like, I was working my 12-hour night shifts, and then I'm trying to sleep, but then I would go pick up the kids from school at like 3, and that's essentially like getting up at 3 in the morning to go pick up your kids. And then I would be like, oh, I've got to go back to work tonight. And then it started to get worse and worse, where I'd wake up at noon and just lay there and be like, I'm exhausted, but I can't sleep. What am I going to do? And I was worried about making a mistake. And so then I was doing a lot of negative self-talk, like, I'm not that good of a nurse, like, you know, just really down. I'm not winning as a nurse. I'm not winning as a mom. What am I doing? Like, so I really struggled. And I found that sleep is something that I really look forward to. I like to play like a meditation before I go to bed, right? When I get in bed, I play use an app and play some kind of meditation to get myself ready to sleep. And I find that I have much more restful sleep these days. But historically, I was always ruminating, like thinking about everything I had to do the next day, thinking about everything I had done the previous, shift, and how that went and how I could have done it differently, and just like replay it.
Yeah. And then because you're replaying things and because you're, I'm not a good nurse, I'm not a good mother, and you're having these thoughts and you're ruminating, it's causing you to have poor quality of sleep, and then you're not able to replenish, and then you're just depleting yourself until you reach a breaking point.
Yeah, even more. And so I thought, well, I just need to get off the night shift. And this is something that a lot of healthcare professionals do. They think, I just need to change my scenery,
right,
and it'll be better. Like, I got to get off the night shift. So I switched to day shift. And that actually took me physically like 6 months to feel like more rested and more like regular, because there's a lot of things about working the night shift and a lack of sleep. Like, I felt like it messed up my GI tract. I felt like, there were a lot of other symptoms I had physically. And it took 6 months for me to like sort of feel like, okay, I feel more regular. But I never at that point dealt with all the things that I was dealing with at work, in terms of like, we had kids with cancer, very serious diagnosis. Like, my first code was very difficult for me. The first patient I had who coded, that took me months. Like, I would ruminate on that before I'd go to bed. What could I have done differently? And at that time, we didn't practice debriefing where I worked, which is, there's plenty of evidence that talks about how debriefing is like really important for those kinds of things. And it's often with doctors or in the ER, but we need debriefing like all places where patients have unexpected events. But we didn't debrief on my first code. Like, I went home and went to bed, not really sleeping afterwards, and was supposed to come back the next day. And that stuck with me for quite a long time, like, worrying about that and thinking about that. But I didn't deal with those things switching to day shift. I just sort of pushed them aside, pushed them down.
Yeah, I like what you said about sometimes we think we just need a change of scenery. And in this case, like, I can relate where like you can change your scenery, but if you're not able to deal with the internal things that are going on inside you, your signs and symptoms and how you're coping with stress might not change, and you're going to be in the same place that you were. And so, sometimes we do need to go to a better, like, get a better job, or and that can really help, because burnout is a both type of scenario, not just one or the other. So,
yeah,
but it's like, if we find ourselves in the same or a similar setting, but we're not dealing with the inner problems, then how are we going to expect to change? And we're always going to keep looking for something else instead of dealing with what's inside. I was thinking about when the things you've been talking about. I've been thinking about energy and how burnout can be kind of contagious, or it can be something that is taboo and maybe something everyone's feeling but unspoken. Or in your experience, have you been a part of facilities where it is this general like atmosphere of, and that's just how it is, where it's like it's kind of affects everyone, or is it just isolated cases of it, or?
I definitely think about, like, I think I mentioned that earlier when I said how I was working as an educator. And so at one point the administration said, I think we should do a class, pain management. And they had like the pain service put together a presentation. And then they had another group, maybe a social worker, put together a presentation. And then we kind of had this conversation where I said, well, can we talk about the nurses as they experience caring for people who are suffering? Because it affects them emotionally. And so they let me tack on this like self-care. And this is kind of the first time I addressed self-care as an educator. We tacked on this self-care maybe 45 minutes at the end of the class. And it was a mandatory class that all the staff in the oncology units and bone marrow transplant staff had to go to. So it was kind of a fun place to sneak in information. And it was just an introduction to self-care, and talked about compassion fatigue, burnout. What does that look like? What are the signs and symptoms? And what can you do? What self-care strategies can you use? But the conversation, looking at the faces of the people in the room and like seeing people tear up just thinking about this concept was, for me, was like, oh my gosh, I think we're all feeling this and we're not really addressing it. And from there, we started doing this. The social work team, who's amazing, wanted to do this monthly kind of, I guess, tea time. I forget how they phrased it, but kind of tea time where once a month, like for both shifts, they would have this tea time where you could come to a room and just talk or just listen and share like experiences and how you're feeling. And I think it was a good initial step in like addressing the fact that we were all feeling stuff, but nobody was doing anything with it. They're just sort of pushing it down. And that's one of the things that I try to teach people about is emotional labor, like the work that you have to do to manage your emotions can lead to increased rates of burnout. So the more times you have to push down emotions or create emotions that you don't actually have, the higher your risk for burnout is. So like, how you have to go from one room that maybe has a very emotional experience happening. Maybe the patient is at the end of life. Maybe you're very sad about it, but we all have to go to the next patient's room and create like, hi, how are you? How's it going? And sort of push that down. So there's a lot of that in nursing. We use so much emotional labor to create the right environment and provide empathy for our patients. So we're definitely increase our risk for burnout because of that.
Yeah. One of the classes I taught last year when I was an adjunct was human interactions, and how we have different modes of interacting with patients. And that within itself, it's knowing how to adjust yourself, like you said, to interact with your patients so that you can gain the most, build the most rapport and help them where they need it the most. So it can be, I've experienced that too, where you go from one room to the next room and you're a completely different person because you're constantly adapting to, be available for your patient. And I love that you said, I know you said a few minutes ago, you talked about debriefing, and then now you just talked about like a tea time. So I really like that you're focusing on increasing having a space for nurses and healthcare professionals to talk and interact. So what are some other ways that in the workplace that we can focus on enhancing our interactions and getting these like taboos out there?
Yeah, so debriefing is definitely something that I think all hospitals should implement. A lot of hospitals have like employee assistance programs where they have so many sessions of therapy a year, but there's definitely a hesitation in staff to utilize them. But I think that that's a really great opportunity. And also, we started partnering with our psychologists that worked in that program to come get involved in certain activities on the unit so we could bring them more into the unit and address things. One of the things that I wanted a lot was to start self-care training in the new grad program. Most hospitals have like some kind of new grad orientation program. Mm-hmm. And it's like, 13 to 17 weeks long where they train, they have didactic, and then you have a preceptor on the unit. And I think that in those places, because new grad nurses or nurses that are highly idealistic usually have higher rates of burnout because they haven't yet learned coping strategies and they have these high expectations of themselves. So I think that's a perfect place to start teaching, since it's not happening in school, start teaching them self-care strategies. And it would be great if we could, implement that in the program and partner with staff nurses who would like to come and share their self-care strategies and make connections that way. I think having mentors, somebody at work that you can really talk to about these kind of things is important. Some research on happiness shows that if you have like a workplace BFF, you have a greater amount of happiness at work. But finding that person that you can connect to in a way that's like helping build each other up is really valuable. I worked on one unit for like 3 months when they needed someone to just fill in while someone was out. It was a cardiac unit, and the staff there had done a really amazing job of supporting each other. Like they would put up charts of how much they were like really trying to support each other in drinking water and eating healthy and some of these basic self-care physical things, where they had charts of like how much water they were drinking, and they would like check off, and they would support each other, and they would plan to order food that was like, eating healthy, which is the opposite of most nursing units. You get a lot of patients who give donuts and cookies and junk food to the staff, or the hospital says, oh, we want to thank you, so we're sending pizza. So this unit really took it upon themselves to individually like cheer each other on and support each other. That's a big change that we have to do, I think, is the individual support we give each other. Tell each other, like, take time off if you're sick, go on vacation, make space for yourself.
Yeah, because we absolutely, I just think that like in a lot of places there's a taboo of expressing yourself, and having a work BFF, like you said, I've read stuff about that too, and in a way that is supportive, because I've been in situations where I had someone I could trust, but then it ended up being that person brought a lot of negativity about the workplace. It was just like a really strange situation, and I felt like that, although I could trust her, it wasn't the support that I needed, and actually kind of made things worse. So I feel like having the support you need, being open, breaking down those taboos, and some people like have to prove that they are this competent nurse or this competent therapist, and they become so hard on the outside. So I think having a space for people to really let their guard down and be a human, and they don't have to always wear that role, because I've seen some people, they're just I've seen people I've worked with that are, when they're alone doing notes, it's like they can let their guard down for a second because they don't have to prove themselves. Like, it's just so exhausting, to constantly be proving yourself, and to hide that, yes, you are to hide that you're overwhelmed or you're stressed. So like bringing effective communication, ways to better communicate, ways to facilitate conversation, checking in with yourself, more than just the meeting of, okay, here's what we need to do. Like that, I think a lot of facilities have these meetings of like, you're doing this wrong, or you need to do this better, in short. And it's like, where is the two-way communication that I think a lot of places are lacking?
I think too, I really enjoy the cross-disciplinary work. The more that I found that I partnered with like OT and social work, I felt like the more that it validated what I was thinking was going on. And maybe that's because in some of these places they're more apt to talk about it. I'm not sure if that's it or not. I feel like in social work they're much more apt to talk about burnout and how caring for others affects us. And so I found the more that I reached out to these groups, like we had a OT that worked in our bone marrow transplant unit who was amazing, and she was a great person that you could talk to about how work was affecting us and how what kind of strategies could we do to deal with this. So I really enjoyed some cross-disciplinary work instead of working in like these individual silos of like, we're just nurses and you're just those occupational therapists and you're just physical therapy. Like really coming together because we're all impacted by it. And there's some great work that other groups are doing that we could copy or learn from.
Yeah, exactly. I really enjoyed having that interdisciplinary approach whenever I, like during my field works or even during some of my experience working in smaller clinics where it's just speech therapists and OTs, whenever we have that crossover where we're talking about the well-being of our patient and we're also friends and supporting each other versus working in silos even amongst our own team. Like I just felt like there's a lot more warmth. We're in healthcare and it is serious and we have serious cases and there's a lot of serious moments and our work is important, but also creating warmth amongst each other is kind of like the glue that holds us all together so that we are a living, breathing, beautiful workplace that not just cares about improving our patients, but making sure we're at a place where we can support each other so that we can continue to be there for our patients.
Yeah. I also think that some of the other professions have, I've learned self-protective strategies from them. And I don't know if it's just happened to be the place where I worked or if they learned that in their programs, but there's just such a lack of it in nursing education of how to take care of yourself that it was a good place to reach out and find information and strategies from other people who work in healthcare so they could, relate to what you're saying. Because it's much harder to go outside of healthcare and talk about how your job affects you and have people understand where you're coming from.
Exactly. Yeah, our situation is unique. And so the work that you're doing in speaking and teaching about, some of these self-care strategies and other ways that we can take care of ourselves, that's really important. And that's a part of the dialogue that was missing. So I thank you. And, I wish you all the success in your journey.
Thank you so much. And I really appreciate you making time to have me on the podcast. And I really enjoy listening to it. I really like that your approach to this topic and how you have like a very personable approach. And so I really enjoy listening to the interviews that you have.
Well, thank you. I loved having you on. This was a really much needed conversation. So where can people stay connected with you and all your work?
So I have a website, selfcaretravels.com, and I also have an Instagram, selfcaretravel. I'm working on building my speaking opportunities. I'm going to be at Keck Medical Center in April doing a talk on self-care with their all-day AACN conference. But I'm trying to open that up more, and eventually I'm going to host my own events. But awesome. Right now you can find me on my website and on Instagram.
Awesome. It looks like we have very similar aspirations and paths, so that's exciting.
Yeah, very exciting.
So I would like to ask you my signature question. What makes you your most lit up self?
My most lit up self? I'd say when I can be really present. So some ways that I help myself get really present is doing yoga. My husband and I like to do yoga at home together because it's like real low key, but it really helps me get like in the moment, and I usually feel really replenished and really like happy and grateful when I'm finished. And I love that we're doing it together, so I feel like it really strengthens our connection. I think also like really good quality time with my family helps me feel really joyful and grateful.
Beautiful. Thank you.
Thank you.